My name is Phoebe Campbell, and today I will be discussing some basic fall prevention techniques and how to prevent falls on a nursing unit. As well, we will be looking over how one can be a high fall risk, what assessments can be done to determine if someone is a high fall risk, and what we as healthcare professionals can do to prevent falls on the nursing unit. The goal of this presentation is to design, implement, and evaluate fall prevention methods set in place on a nursing unit and describe fall prevention techniques and ways we can prevent falls. The three learning objectives are to be able to identify strategies to help prevent falls, being able to assess and identify someone who has an increased risk for falling, and provide education on fall prevention and interventions. By completing this presentation, you'll be able to complete a short 5 quiz on fall preventions. All questions will be answered and clarified. Nurses on the unit will implement the learning and fall prevention methods and implement these methods for each patient. Nurses will be able to assess and identify someone who has an increased risk for falling, and nurses will be able to educate and return demonstration given on fall prevention techniques they have learned today. So outcomes for the nursing unit. With these strategies implemented for every patient at increased risk for falls, a nursing unit should have decreased risk for falls, and most importantly, a decreased risk for falls with injury. With this education provided, nurses can take what they have learned and begin implementing each step and standardize this with each patient interaction. More education given would cause for a safer and more comfortable stay for each patient. And nurses who attend this presentation will give feedback and proceed to educate the patients on the importance of fall prevention in the hospital and when they go home. So why is preventing falls so important? Fall prevention is a serious topic to consider at any point throughout life, but becomes more relevant when we age. Falls being the number one cause of harm and fatal injury in adults 65 and up. More than 1 out of 4 adults fall, but less than half actually tell their doctor. Falling puts one at greater risk for serious injury or medical condition such as a head injury or a hemorrhage. Educating and preventing falls greatly reduces one's risk for injury by falling, because falling once can double your chances of falling again. So what can cause someone to fall? A lack of exercise or weakness. Now, when people are afraid of falling, they might tend to not move as much. Their muscles grow stiff and their joints grow stiff. Balance impairment or unsteady gait. When they walk, they might lean to one side more or tend to lean back a little bit. Dizziness or lightheadedness. People with medical issues such as dizziness might be due to low blood pressure or hypotension when their blood pressure is too low. Problems with feet or nervous issues. This is talking about people with neuropathy in their feet causing pain, numbness, or tingling, make it harder for them to feel the ground they're walking on. Confusion and memory problems definitely make it easier to fall, and not in the sense that the person might be unsteady, but because they might be a little confused or turned around. Bladder or bowel problems. This is talking about urgency or frequency. So when someone has to go to the bathroom quickly, then they might not be too aware of their surroundings and the hazards that can cause a fall around them. Vision problems can make it more difficult to see where one is going, so the use of night lights is really important with this. And medications. In my opinion, this is the biggest risk factor because not many people know the proper education when talking about their medications they take, such as sedatives or sleeping meds such as Ambien, Trazodone, lorazepam, diazepam, blood pressure medications such as beta blockers that lower the blood pressure, and narcotics. Hydrocodone, oxycodone can make you very sleepy and difficult to wake up. So how to know if someone is at an increased risk for falling? So we want to determine if someone is a high fall risk. At many facilities, these protocols are in place to follow to determine if someone is a low, medium, or high fall risk. At my facility, we use the Johns Hopkins Fall Assessment Tool, which measures based on assessment and history if someone is a low, moderate, or a high fall risk. We're going to ask, have you fallen within the last 6 months to a year? If this is a yes, this will determine a lot. This already puts them at a higher risk for falling. Ask about past medical history. Do they get dizzy when they stand? Ask about mobility or gait. We want to assess this, so we want to have them walk towards us and walk away from us, seeing if they pick their feet fully up the ground or if they kind of have a shuffling gait when they walk. And make sure they use their cane or their walker when they do so. Are they alert and oriented? Ask gently about bladder or bowel regimen if there's any urgency or frequency going on, and review all medications for potential side effects. So how to prevent falls at home? Staying physically active, again, so we don't grow weak and stiff. This can include walking, water aerobics, tai chi, yoga. This improves strength, balance, coordination, and flexibility. Using assistive devices such as walkers, canes, handrails, a raised toilet seat with armrests so it's easier to stand up, or a shower or bath chair. Remove any hazards, clearing all walkways for those high traffic areas, moving electrical cords, securing loose rugs, using a non-slip tread on rugs, repairing broken floorboards, storing every use items daily in easy to reach places, and cleaning up all spills immediately. Light up your living space. We talked about this with vision problems, using night lights in high traffic areas, bathroom, bedroom, kitchen, or hallways. Make sure lamps are easy to reach, and make sure there's a clear pathway to all light switches. And of course, wear sensible shoes with a sturdy flat sole, non-skid socks as well. So, education on how to prevent falls in a nursing unit. Now, based on where you work, your policies might be a little different regarding fall techniques, but we want to familiarize the patient with their surroundings. This is a big one for the confused patients to make sure they're reminded of where they are, hospital versus home. Maintain side rails up. This might depend on where you work. At my facility, 3 out of the 4 side rails can be up, but 4 is considered a restraint, so make sure you know your updated policy on that. Using fall mats on one or more sides of the bed, add grips to the floor, and it can reduce the risk for injury if someone does fall to land on the floor itself. Keep frequently used items within reach: the call bell, the phone, the charger. Use non-slip socks. Use the better chair alarm always. Place a fall risk bracelet on the patient and outside the room to make sure that all staff knows entering the room they're a high fall risk. Maintain bed in the lowest position with breaks on at all times. Use assistive devices such as the bedside commode, the Hoyer lift, or the gait belt. And regularly ask the patient if they need to use the restroom or if they would like any incontinent devices such as a PureWick for the female patients. So how did I implement this project of mine? First, I began by posting a flyer I made regarding fall prevention tips and tricks at my nursing unit on the unit so nurses and patients can view them. I also made a three-folded poster which I displayed at the nursing unit. I submitted many materials such as an anecdotal bibliography on 10 fall prevention and education research articles I had found, a paper comparing and contrasting universal fall prevention techniques, comparing them to universal methods and the ones that are used on my nursing unit, and a paper on the overall project and its outcomes. During my literature review, I learned that fall prevention methods used on the nursing unit, if not all, but many, were the same universal fall methods. I presented my practicum project in front of 8 peers at a staff meeting. 5 of the peers were able to answer the short 5-question quiz I gave them on fall prevention and education. I received feedback regarding my presentation and the information within. The feedback was almost all positive in regard to the presentation. The only critiques I received were how to keep the audience engaged, telling a story, asking questions, so on and so forth. And here's some pictures of my flyer and my poster board I made. I posted out at the nurse's station. So how can this project help with my lifelong learning? This project has helped me in many ways. It taught me it's more important with safety. These measures can help increase the risk for patients and nursing safety and increase the knowledge of risk for falling. This project can help with lifelong learning and education by expanding my research abilities and knowledge on the subjects needed throughout life. And the research included in this project will help me through my future educational plans and help me further my education in the future. Here are my references. Thank you so much for watching and attending my presentation and allowing me to educate you on fall prevention. There is a short 5-question quiz in the comments. If you have any questions, please feel free to reach out to me. Thank you so much. Have a good day. Bye-bye.